This is going to be medical terminology, chapter 5. Is your EMS and education standard competency used to find the foundational anatomical and medical terms and abbreviations in written or communication with colleagues and other healthcare professionals. So, medical terminology is used to describe and record every aspect of patient care, including medical history, assessment results, treatment, and outcomes. It's derived from the Greek and Latin terms. So, incorrect medical terminology usage could lead to ineffective or even harmful treatment to a patient and could cause the patient to lose trust in your ability to provide appropriate care. The thing is, I always say about medical terminology, if you don't know what it means, and you don't know how to pronounce it correctly, then try not to use it. Try to use some other type of language. That way, there's no confusion in what you're doing. So your comprehension of key terms, acronyms, symbols, and abbreviations is important for effective communication and documentation. So this requires you to break down each word into its separate components, the prefix, the suffix, and the root, and to have a good working knowledge of those parts. So some EMS systems have specific lists of approved medical abbreviations and terms, and you need to check with your local systems, agencies, even state agencies to make sure that you know which ones that can be used and cannot be used. There should be a list in your policies and procedures. So the more extensive your vocabulary is, the more competent you will seem to be by the rest of the medical community, and the better the patient care you will be able to deliver. So most medical terms have either a Greek or Latin origin. An eponym is the name of a disease, device, procedure, or drug based on the person who invented, discovered, or first described it. Okay, so it gives examples here of the McBurney point, the Foley catheter, the Babskin reflex, Crohn's disease are all named after people that come up with it. All right, homonyms are a pair of words pronounced but the same but spelled differently with different meanings. Antonyms are a pair of roots, prefixes, and suffixes that have opposite meanings. And then synonyms are a pair of word roots, prefixes, and suffixes that have the same or almost the same meaning. All right, the prefix appears at the beginning of a word. Generally describes the location or intensity of the word. What, how, why, or when. It's also used to specify time, quantity, and number. The suffix component added to the end of the word root changes or adds the word's meaning or provides further definition. Usually specifies a procedure, condition, disease, or part of speech. So an example of the suffix is a -ase indicates an enzyme. So like lipase is the enzyme that digests fats. All right, the root establishes the basic meaning of the word and frequently indicates a body part. Combating vowels facilitate the formation of new or more complex terms. So a combining form is a word root, prefix, or suffix with a combining vowel. So osteopathic is an example. First word root is osteon, osteon. So all right. Compound words, terms that contain more than one word root. Each word root retains the basic meaning. So electrocardiogram, thermometer, osteoarthritis. All right, plural endings, rules to change a medical term from singular to plural. In most cases, add an -s to a singular word. So some words ending in a are changed to ae, some ending in is changed to es. So it's just different ways to add plural to a singular word. All right, here's some topographic anatomy. So superficial visible features on the surface of a body serve as guides or landmarks. Anatomical positions: person is standing and facing you, arms at the sides, with the palms of the hands facing forward, so the thumbs point away from the body. Okay, so this is the anatomical position in this graph picture here. So anatomical planes, an imaginary flat surface dividing the body horizontally and vertically into sections. So the coronal plane divides the body vertically. The transverse plane divides the body horizontally. The sagittal plane divides the body vertically. All right, the axis is an imaginary line that divides the body equal and creates a point of rotation. Okay, the anterior posterior axis perpendicular to the coronal plane. The longitudinal axis perpendicular to the transverse plane. The horizontal axis is perpendicular to the sagittal plane. And then a cross section is taken by slicing an object perpendicular to its long axis. So a longitudinal axis is a view of an object cut along its long axis. Okay, many bodies have a specific name, so some are called body cavities called dorsal and ventral. So a specific name is sternocleidomastoid muscle, and that's the muscle in the neck. Okay, if you divide all that word up, you get sternum with sterno, clavicle with clavicle, and mastoid with mastoid at the bottom, at the end. Okay, there are some body cavities. The dorsal cavities, posterior area, include the cranial cavity, spinal cavity, and then your ventral cavities, anterior, include the thoracic cavity, abdominal cavity, and the pelvic cavity. Directional terms, please know these. You got distal, anterior, medial, lateral, anterior, posterior, so superior and inferior. If you don't understand these, you need to take time to try to. The reason being is that you can be describing a particular injury, a particular sign that you see on the body, and if you're able to say that it's just distal to the elbow area on the anterior side, that kind of gives them a more specific area as to where you might find that particular sign that you found. All right, here's some directional terms on right to left. And always make sure right to left is the patient's right and left, not your right and left. Okay? And the definition of each one of those. All right, range of motion and positional terms. Range of motion is the full distance that a joint can be moved. Flexion is moving the distal point of an extremity towards the trunk. Extension, return of the body part from a flexed position to an anatomical position. Abduction is of the extremity, moves it away from the midline, and adduction moves the extremity towards the midline. Okay. Picture right here, positions of the neck in a patient in a supine position. So supine is the patient laying flat down on the back. So in position A, the neck is in neutral position. Position B, the neck is slightly flexed. And position C, the neck is extended backwards, as you might do with a head tilt chin lift. Okay, hyper indicates excessive movement, such as hyperextension or hyperflexion. Supination or pronation is turning palms upward and downward. Internal and external rotation is turning extremely medially towards the midline and away from the midline. All right, bilateral appears on both sides. Okay, so we may have bilateral lung sounds. Unilateral appears on only one side of the body, so we may have only lung sounds on the right side and none on the left. Ipsilateral is the same side of the body, and contralateral is the opposite side of the body. Here's your different abdominal quadrants. So the one on the left that you're looking at is the simple 4 quadrants that most people use. The one on the right breaks it down even more into the 9 quadrants. Most people use the 4 quadrants, a little bit simpler method. But if you're good enough, you can use all 9 if you needed to. All right. So here we're describing the position in which a patient could be found. So prefixes include position, direction, and location. So it describes the movement of the body or something within it, indicates the location of an organ, foreign body, or mass, and refers to the direction of radiation ultrasound waves. So specific terms such as prone is laying face down, as you see in picture C. Supine is laying face up, as you see in picture B. Fowler's position is sitting straight up with knees either bent or straight, and that's in picture A. Or semi-Fowler is sitting with the back at a 45-degree angle, which is picture A2. Then the recovered position is lying on your side, so that you can possibly suction stuff out of the mouth if needed. Alright, abbreviations, acronyms, and symbols does sometimes enable faster communication, but be very, very mindful of that communication and what those abbreviations and acronyms can be used for and misunderstood for. Okay, so USAR is the Urban Search and Rescue. If you go inside the hospital and say USAR, they probably don't know what you're talking about. SAB has several different meanings throughout, even the civilian world versus the EMS world. So be mindful of that one when you use it. So just make sure that it's consistent throughout everyone that they're treating patients for and with. Only use symbols that are widely understood and accepted. Avoid using trailing zeros after a decimal point, but include leading zeros prior to the decimal point, and when in doubt, write out the full term. Okay, so you may get 5 milligrams, which is 5.0 of a medication, or you may use 0.5 milligrams. Okay, so if you're using the 0.5, put the 0 out there in front of it. If you're using just the 5, just leave it as 5. Because if you use 5.0, that could be misunderstood or misread as 50 milligrams. So just be mindful of that. Only use symbols that are widely understood and accepted. The Joint Commission requires every hospital to issue a list of approved abbreviations. So, and if you don't know, just write it out completely. Alright, here's some commonly used symbols here. Make sure that you're using that greater than, less than, not equal to, all that stuff. Make sure that you have it correct. If you have it incorrect, it can cause a lot of problems in your paperwork. Be familiar with terminology related to medications and medication administration, some common prefixes, common metric conversions, and common medical abbreviations. So micros, MC, milli is M, centi is C, kilogram is K, and kilogram could be misunderstood as, ketamine also. I'm sorry, potassium. So be mindful of that too.